Well, a new study is raising a few eyebrows, highlighting the risks of long-term use of a popular sleep supplement. Well, here to share why these findings shouldn't keep you up at night, let's welcome back Chris Jackman, nurse practitioner at Carolina Holistic Medicine. Glad to have you back with us.
Good to see you.
So we're talking, of course, melatonin.
Yeah.
That has been such a popular sleep aid for so long, and then now we're hearing of this study. Fill us in a little bit on what the findings were.
Yeah, so what they did was they took a group of, I think it was about 140,000 people, and this was not a study in that they asked people to join. This was a chart review. So they went back and looked at just charts of people who had insomnia. And what they looked at is they had a group of people who had insomnia that took melatonin and a group that did not take melatonin. And then they tried to see how many of those people who took it got heart disease as opposed to how many people who didn't take it got heart disease.
Mm-hmm.
And so it was a chart review. And they found that about 4.7% had heart disease on melatonin versus 2.6% or so that did not take melatonin.
Which, when I saw the headline, it caught my eye because I don't take it personally, but I know a lot of other people do take it regularly.
A lot of my patients do, yeah.
And in the past, you know, traveling, trying to adjust to time changes and things like that, you take it.
Right.
And you think it's perfectly safe, but the study was missing a few very important components. And I know that some patients came to you as well with some concerns.
Yeah, a lot of concerns and questions.
Yeah.
And the study may be fine, well, you know, but there are concerns in the study. One is that many of the patients in the study or the charts they reviewed were from countries that don't require melatonin as a prescription. So like in the United Kingdom, you need a prescription to take melatonin.
Is that right?
Yeah, so they're easy to track. If they got a prescription, you know they're on it.
Of course.
The patients in America that were in the insomnia group without taking melatonin, there's no way to know if they just took it on their own without a prescription because you can get it over the counter. So many of those people in the non-melatonin group may have been from countries where they can buy it over the counter, and they may have been taking melatonin to begin with, and the study just didn't know it.
Are the qualities of the melatonin different between what's sold over the counter in the U.S. versus what you're being written a script for in the UK?
No, it's the same. The doses may be a little different depending on how aggressive the provider wants to be, but it's the same thing. But in different countries, they have different standards as far as what is safe.
Right.
And in many other countries, they feel like melatonin should be written by a provider.
That's really interesting. So what are the components of melatonin? Why is it such a popular choice to help people sleep better? And who would you recommend should maybe consider taking melatonin?
So melatonin is a natural hormone produced in our body. As the day goes on, our body produces more and more of it. And then by nighttime, we have high levels of it, which help us fall asleep. So to kind of replicate that circadian rhythm, people take melatonin in the evening to ramp up their levels just like their bodies are supposed to do, and it helps you fall asleep. So melatonin is great for circadian rhythm, so that sleep-wake cycle. It's good for when you're changing time zones, which you kind of said when you travel. It's also the hormone most produced by our gut. So our gut uses melatonin to help balance out our immune system to fight off bacterial infections and things like that. So it's good for gut health. We use it in cancer treatment all the time. It helps other cancer treatment work better. It helps with keeping your immune system fighting off the cancer. It prevents the cancer from spreading. So there's many, many reasons to take melatonin. And I don't think we should be scared off by melatonin because of this study. I think we should think about, should we be taking it every day? Do we need it every day? And if you don't, take it 3 times a week or 4 times a week. Yeah. But if you do need it, I wouldn't be scared by this study and say I'm just going to completely go cold turkey.
Right, okay. And a couple of things. So you mentioned that we produce melatonin ourselves and we produce more and more of it as the day wears on, which does help us sleep. So, of course, I'm thinking, well, the longer the day, the more exhausted you get because you're expending energy.
Right.
But then the people who are true insomniacs, is it that they're just not producing the melatonin that they should throughout the day to then help them fall asleep?
Yeah,
or
it's usually multifactorial.
Yeah,
so it's usually not just their melatonin production, but that could be a big part of it, especially if melatonin works. Then you would assume that you're probably deficient in it and that it's a good supplement to take. But there's other hormones, progesterone, there's cortisol issues, there's
Right.
mental issues.
And so for patients, they can come get an assessment from you, and then you can kind of gather whether or not it's a low melatonin production
Yeah.
or too high cortisol, and just try to get some balance in their
Right,
system based
and
on.
decide what dose to take, because
Right.
you can have as low as 1 milligram to as high as 20 milligrams or even
interesting.
higher. So, some people require higher levels of melatonin to get their sleep. Some
Yeah.
people just need a tiny dose. So the lowest dose for the best results is always the best option.
Yeah.
And if we can find other reasons why you have insomnia,
Yeah.
we can fix those and be less reliant on sleep aids
Yeah.
to help you fall asleep.
Very good. And it's always important for people to consult their health practitioner.
Even
the
for
best
supplements,
advice.
there's
Yeah.
supplements have their side effects and negatives too. So you have to make sure you're doing all this
That's right.
safely to make sure that your overall health
Indeed.
is thriving.
Chris Jackman, thank you so much again. Carolina Holistic Medicine. We'll be back after this.